Good morning, everyone. My name is István Baradács, and today I will present you the 3 months progress on my PhD topic, which is targeted therapy for ovarian and endometrial cancer. First of all, I would like to introduce our team and myself in some words. I'm a resident doctor at the Department of Obstetrics and Gynecology at Semmelweis University. My supervisors are Balázs Lindner and Ferenc Bánhidi. Our SMS is Brigitte Teutsch, and the statistician is Alex Váradi. My vision is the molecular targeted therapy could completely change oncological treatment, and the mission behind my work is to learn about the possibilities offered by individualized therapy for gynecological malignancies and to bring the knowledge back to the bedside. In September and October, we started to work on 2 different projects. The first one is a meta-analysis in which we investigated on the efficacy and safety of PARP inhibitor therapy for advanced ovarian cancer. And the second one is a prospective observational study on testing and scoring HER2 positivity for high-risk endometrial cancer. So let me go into the details of my first project, which is a meta-analysis. Let me give you some background of our first study. Over 75% of ovarian carcinoma cases are diagnosed at an advanced level, and with standard chemotherapy, the relapse develops in 70% of the cases. These facts highlight the need for a new effective therapy. And based on recent clinical trials, PARP inhibitors could be a new therapeutic pathway and a possibility for the solution. Because they showed a real good improvement, a big progress in the progression-free survival for these patients. Let me talk briefly about the PARP inhibitors. PARP is a family of enzymes that detect the single-strand DNA damage, single-strand DNA breaks, and trigger the DNA repair. And PARP inhibitors are preventing this repair mechanism and facilitate the double-strand break formation on the DNA. And here you can see this on this simple image. PARP inhibitors are particularly effective in BRCA mutated and homologous recombination deficient cancers, because in these conditions, the double-strand break repair of the DNA is less effective than in the wild types. Okay, and our aim is to assess the efficacy and safety of PARP inhibitor therapy for advanced ovarian cancer. Our question is, do PARP inhibitors provide longer progression-free survival for patients with advanced ovarian cancer? Or patients are diagnosed with advanced ovarian cancer, or intervention is PARP inhibitor therapy, or control is placebo, and our outcomes are progression-free survival, overall survival, and adverse events. Our hypothesis is that PARP inhibitors provide a better progression-free survival and are well tolerated for the patients. And the clinical implication for this study could give a prolonged overall survival for all the patients. In the middle of October, we ran a systematic search with the search key above in these 3 internet databases. And the search resulted in over 8,000 articles, which we went through with this flowchart. And finally, we found 36 eligible full text for our meta-analysis. And we have already started data extraction, which we will finish in the next few days. And let me continue with our second project for the rest of the presentation. As I said, it's an observational study on the testing and scoring of HER2 positivity in high-risk endometrial cancer. For the background information, high-risk endometrial cancer only accounts for 10% of endometrial cancer cases, but it's responsible for almost 40% of all uterine cancer-related deaths. Treatment with trastuzumab, it's a HER2 inhibitor, is a possibility. HER2 inhibitor treatment works properly in breast and gastric cancers. Determination of HER2 positive patients is very good too in these carcinomas, but such a pathological evaluation system is not validated for endometrial cancer. Fluorescent in situ hybridization could provide us the answer which patients are HER2 positive, but it can't be used in the daily-based clinical practice because of the high cost. So there is a need for an immunohistochemistry-based testing and scoring system for endometrial cancer too. And our aim is to develop a new immunohistochemistry-based testing and scoring system to detect the HER2 protein overexpression in high-risk endometrial cancer. Our clinical question is, what is the diagnostic accuracy of our newly developed immunohistochemistry-based scoring system? Our patients are diagnosed with high-risk endometrial cancer. Our index test is immunohistochemistry. Our reference test is FISH. And the outcomes are the semi-qualitative levels of HER2 positivity on the slides. Our hypothesis is that the specificity and sensitivity of our newly developed scoring system is non-inferior to FISH. The clinical implication of these studies could be it could give an effective method to determine HER2 positivity in advanced ovarian cancer and could be used in daily-based clinical practice. We started protocol drafting, and consultation with the pathologist is ongoing. I would like to finish my presentation with the words of Hippocrates: wherever the art of medicine is loved, there is also a love of humanity. Thank you for your attention.
Thank you for your presentation. I was wondering, in your first project, you mentioned that you are going to compare the PARP therapy with placebo. And I know that you probably work from papers that have been published, but could you tell us why is it compared to placebo and why not the chemotherapy what is already existing, as this is an advanced level carcinoma? I was wondering, is it ethical to compare it to placebo instead of chemotherapy?
Thank you for your question. First of all, you have to see that these treatment lines are third and fourth lines therapies and maintenance therapy as well. So in a daily basis, that patient received surgical treatment and chemotherapy before, and PARP inhibitors is added as maintenance therapy as well.
I have actually two questions. That one is for the second topic. That so you compare this immunohistochemical method. I mean, you plan to do this with FISH. So what's the advantage of the new method compared to FISH?
The advantage is not compared to FISH, but if we would like to compare it to FISH, it can be used in daily-based clinical practice because it's much more cheaper.
Yeah, so that's the advantage, actually, most probably. Yeah,
that's a big advantage, I think, because fish is the cost of fish is too high to use it on every patient every year, every day.
So, are there plans to do this in an automatic way? So, therefore, actually, no MEM-force is included. That you just put the sample on a stage or cut it through and then use it and then use. I mean, in gastroenterology, actually, there are some similar kind of, I would say that, automated methods, and that actually accelerates this kind of selection, and also the bias is kind of excluded.
Yes, at this stage of science, this state of science, the diagnosis, the pathologic diagnosis is human-based, but there's also plans for do it with the AI system.
The other question is on your first topic. So what kind of adverse effects could come with PPAR inhibitors? And is this really significant? So how do you, I mean, because you probably have a hypothesis, I mean, you know something about this, and then you get the data from over there. But what is the presumption?
It's a very good question, thank you so much, because mainly there are light adverse events, adverse effects, like nausea, anemia, and these kinds of effects. But in some cases, the PARP inhibitors showed really severe adverse events like myeloprogression and acute myeloid leukemia. So it's a big question that the cost-benefit level of these kind of drugs are good enough to use it really in the daily base practice.
Thank you. I have a question as well regarding your second project. Actually, you were mentioning, and also Gabor asked you about the price, or you highlighted the price of the fish measurement. But I'm really curious. Actually, if we look in the literature, then generally the price of a certain methodology decreases with time. For example, also if you wanted to sequence the genome or something, the price decreased. But so this is a good technique, good tool, but the only problem is the price. Could it happen that the price will decrease, and therefore it will be feasible to use it?
I don't think so, because the fish is usable for like decades, but today the statement is still that we need a cheaper one, and in the future it won't be as low as usable for the patients, I think. So the result is only could be an immunohistochemistry based scoring system, I think.
Thank you.
Hi, congratulations, Bálint Erős, gastroenterology. I've got one question about the second project, which is, what is the question for the second project? What is the clinical question you asked in the beginning about the fish and the other tests?
It was the accuracy of our newly developed test.
All right, so in that case, I couldn't understand your PICO, because if you do a diagnostic test accuracy meta-analysis, the outcome should always be the diagnostic accuracy measures like negative predictive value, positive predictive value, and so on. So those are the real outcomes you are looking for. And I couldn't understand the abbreviations in the outcome line, and I'm not sure what that was for.
These outcomes came because these are the levels of the positivity, and on the high level, like 3+ positivity, there's no question that immunohistochemistry and on the scoring system based on it could be good. It could be clinical relevant for a clinical diagnosis. And on the 2+ and 1+ levels of this positivity, it's a big question, because pathologists can determine which is these pathological slides of the cancers are really HER2 positive. There are really overexpressed the HER2 protein or not.
All right, so if I understand well, you have got more index tests which you are comparing against a gold standard.
Yes, we're going to do it too, but the final form, the final plan is to develop a new one, because the tests based on the breast and the gastric cancer. On these cases, these scoring systems for the HER2 overexpression works so good. But in the case of endometrial cancer, we need a new one because the staining of the cells is completely different than in the gastric and the breast cancer cells.
Okay, thank you.
Thank you.